I shared about the experience inside Thailand, not just only the hospitals, and how we create the complaint to praise on the patient food mostly. So that's one of the simple experience that we can do. We share on how Bumrungrad works on creating human experience throughout COVID era. So that's the experience design and how we draw that to ensure that our international patient still intact or in contact with us.
There are a number of challenges that healthcare providers and health systems have been experiencing. Certainly the pandemic shone a bit of a light on them. Things like workforce sustainability, things like a growing population that has chronic disease, the use of technology that perhaps was used for technology's sake rather than thinking about the outcomes, and then also the challenges of, well, the more you digitise and connect, what about this cyber security? How do I keep my privacy and my data of my patients safe and secure? So what I talked about was these are the kind of things that Malaysian healthcare is experiencing over the last few years and are trying to respond to. It's equally so around the world. So how do you respond to that efficiently? And for us, we truly believe that you respond best, and the evidence from HIMSS that we do globally is that healthcare systems have responded best to those challenges with improved healthcare performance by investing in digital transformation. And what we talked about, I guess, after that was, well, how does HIMSS help digital transformation? That comes from having ways of measuring where you are, prioritising where you should invest to next, and collaborating with others. So who should you learn from to be better? So that was the journey, I guess, I took the flagship hospitals on this morning. What are some of the challenges? How do you respond effectively using transformation, and why it's important? And then I guess who are some of the people you could learn from?
So we gave them the basics. However, they have the opportunity to also look into some other areas. And we really encourage them to look into some certification programs to become recognized centers of excellence. We noticed that many of the organizations, they are considering themselves as centers of excellence because they do have clinical outcome data that are really outstanding. However, they don't have adequate benchmark with international recognized societies. But we really push them and encourage them to have that, to receive that recognition, to be able to say that the clinical outcomes that we're receiving is really benchmarkable with international numbers. And this is one of the key focus area. We're pushing organizations to look into it and to achieve some kind of certification for their centers of excellence.
The takeaways today is to ensure that they design their experience well, and also the other thing is they can decide on whether they are going to do the digital transformation or not. The thing is that everyone may focus on the digital transformation, but they may forget patient experience design. So with the digital transformation, it have to go together with the patient experience design with the purpose, and that will equip them to accelerate the success.
The advice is to focus on their foundations first and making sure it continues to be great. So that's around infrastructure. And also to be comfortable about wanting to measure yourself against others on an ongoing basis to see how am I getting better, and then to collaborate out of that process. Because that's the only way you really truly keep getting better, is if you're willing to continually put yourself up to some kind of measurement by somebody else. And that's how you get to meet people who maybe have an idea that you hadn't thought about from another country or from another health system. Be brave enough to put yourself up to scrutiny. Don't be, when I'm great, I'll get myself reviewed. Don't do that, because that is the only way you won't just get better, right? You'll be fooling yourself, really. The best systems that I've talked about, the best couple of systems in this region, Hong Kong and Samsung Medical Center in Korea I talked about today, are ones who think they were great, always have believed they're great. They've invested significantly over many years, but they still felt that external review and collaboration would make them even better, and that's an ongoing process, and that's why they are great. So be brave and be like others.
We do as well recommend that organizations, they need to look into the other healthcare facilities that they had success stories in medical tourism in Asia, in Europe, in Middle East, and even in some American countries. So it's important to learn from them, but they have to select their initiatives very carefully, because some of those success stories, they might be successful in certain countries but cannot be culturally acceptable in Malaysia, but they have to stay focused. So it's important not to dilute efforts. We can have thousands of ideas, but we need to select carefully the ideas that will serve their overall goal in increasing the number of medical travelers during the upcoming 2 years.